Welcome to this edition of the Black Community News Service. This is Steve, your reporter. Today we're going to follow a deepening human rights crisis inside U.S. immigration detention, where the Trump administration's anti-immigration policies are expanding confinement, while families, advocates, and rights groups warn that the system is overcrowded, opaque, deadly, and racist. In California, Immigration and Customs Enforcement, ICE, has added another facility to its detention network. The new site, that is named the Central Valley Annex in McFarland, adds 700 more beds to a state system that already includes about 9,200 ICE detention beds across 8 facilities. As of early April 2026, more than 5,800 people were detained in California facilities, a figure that is nearly double the average daily population from a year earlier. That expansion is not happening in a vacuum. It's happening inside a detention system that has been criticized for years, and now, under the Trump regime, it is growing again. Excuse me. The California City Immigration Processing Center, now the state's largest ICE detention facility, has been the subject of repeated reports on overcrowding, sanitation problems, medical neglect, and extended isolation. State officials and lawmakers have raised alarm, but federal officials and private contractors continue to deny mistreatment. What people describe from inside these facilities is disturbing, and the accounts sound less like administrative errors than conditions built into the system itself. Detainees report cold cells, poor food, insects, dirty bathrooms, limited water, tainted water, long delays for medical care, and restricted access to lawyers and family. In some facilities, people describe prolonged lockdowns and isolation that make mental and physical health worse. These are not minor shortcomings, they are the conditions of punishment, and that punishment carries a deadly cost. Recent reports show a sharp rise in deaths in ICE custody, with 2025 yearly totals described as the deadliest year in more than 2 decades. Many of those deaths were tied to delayed medical care, untreated chronic illnesses, mental health crises, and neglect. People with diabetes, heart disease, kidney problems, and other serious conditions are being held in confinement where care arrives late or not at all. This is why advocates say detention itself has become deadly. When someone enters custody under ICE and their conditions worsen, or when treatment comes only after a medical emergency has become fatal, that is not an accident. That is a policy outcome. It is what happens when the state treats imprisonment of immigrants as the default answer to migration, and when private contractors such as GEO are put in charge of holding people whose lives depend on humane care. But this crisis is not limited to California. International outlets and human rights organizations have reported similar abuse in ICE facilities in Florida, in Texas, and other U.S. states. The recurring themes are the same: overcrowding, denial of legal counsel, unsanitary conditions, isolation, delayed care, and treatment that strips people of their dignity. Around the world, reporters and rights groups have described these centers not only as orderly processing sites, but as places where people are dehumanized. Amnesty International, Human Rights Watch, the United Nations, and major international news outlets have all documented detention conditions that they say violate basic human rights standards. And those accounts matter because they show this is not a local controversy or a partisan talking point. It is a global human rights concern. There is also a legal question regarding the newest California facility. Advocates are asking whether the McFarland site was properly repurposed under state law, which requires notice and public meetings before certain buildings can be converted for immigration detention. That issue matters because it shows how quickly detention is expanding and how little transparency often surrounds that expansion. If public law is being sidestepped, then communities are being shut out of decisions that affect local land use, local safety, and the fate of thousands of human beings. The broader picture is unmistakable. The Trump administration's immigration policy is not only enforcing the law, it is building a larger detention regime, one that relates totally that immigrants can be put in private prisons where weak oversight and a philosophy of confinement that critics say is causing real harm. This is not simply enforcement. This is a system of harm. Across the country, in California, the message from these reports is the same. Detention is expanding, conditions are worsening, and the criminal actions of the Trump administration and the prisons, they're rising the human cost. This is simply not enforcement. This is a system of harm. Detention is deadly.